Hello, my name is Dr. Daniel Kantor, and I'm president of the Florida Society of Neurology. I'm here at ECTRIMS in Lyon, France, and I'm actually standing in front of my own poster. And in this poster, where we look at risk evaluation and mitigation strategies, we're looking at a combination of two drugs commonly used for multiple sclerosis, but for different reasons. One is called fingolimod or Gilenya, and the other one has Dextromethorphan and Quinidine and is known as Nuedexta. Gilenya is used for the treatment of relapsing multiple sclerosis as a disease-modifying agent, while Nuedexta is used for a symptom called pseudobulbar affect. What PBA is when your emotions and your affect, the way you display your emotions and what you feel inside, don't really connect. Now, Nuedexta has a part of the medication that is called Quinidine. Quinidine at much higher doses is an anti-arrhythmic. With the changes that happened in April 2012 by the FDA's package insert for Gilenya, what happened is there's a contraindication now to Class 1A antiarrhythmics. Quinidine in higher doses is a Class 1A antiarrhythmic. So the question is whether the FDA considers the low doses, 10 milligrams twice a day, of the Quinidine that's in Nuedexta a Class 1A antiarrhythmic. What I looked at is going back, so retrospectively, at 6 patients who were on combination Gilenya and Nuedexta, and this was prior to the label change. And I looked at the safety. So I looked at the EKGs that went on before the Nuedexta. I looked at EKGs that went on even before the Gilenya, and then ones after they were on both. And what we saw is it was all over the place. Some people, something called the QTC, got longer, some people got shorter, some people had stayed about the same. So overall, for these 6 patients, it was safe and effective to combine them. Of course, we need larger clinical trials to look at the combination together. We also need advocacy to clarify with the Food and Drug Administration and with the EMA in Europe about whether we can combine these two medications. Besides the effect on pseudobulbar affect, the Nuedexta patients, the patients who had combination Nuedexta and Gilenya, also talked about other sorts of improvement. And that included increase in concentration, reduction in spasticity, increase in wakefulness, and decrease in fatigue. And so we see that there are other beneficial results that we get besides the pseudobulbar affect. So in this poster, what we're talking about is that the safety of Gilenya and Nuedexta look good together, but of course we need larger clinical trials. Thank you for joining me.